Assalamu alaikum. So we today start our lecture on radiology for neurosurgery, and in this lecture we'll discuss how radiology is important uh, for making a diagnosis or confirming your diagnosis which you have gained from your history and examination. And the areas of our interest are skull and soft tissue, and its soft tissue in the head, and in the spine, vertebral column, spinal cord, and exiting nerve roots. Uh, I would emphasize on our treatment process, which starts from the history. History is most important, and both history and examination, they make your diagnosis up to 90 to 95%. And then you go for the investigations, which may be radiology or lab investigations. And once you confirm your diagnosis, then you go for your treatment. But what are the common mistakes that we do when we approach a patient? Even not only when you go in your house job, but when you are doing your post graduation, usually people skip the history and examination and try to make a treatment plan on radiology. And because they don't have history and examination, usually they do wrong level investigation and or a wrong investigation which is not indicated for this disease or this process. And another very grievous mistake which is made usually in ER is that a patient comes to you in subconscious state. He is not vitally stable, and what you do is you send him for CT scan without stabilizing patients. And in this way, I have witnessed, and it is written in the literature, that lots of patients die on their way for the investigation. So please don't do these mistakes when you are in the clinic or in ER. So different radiological modalities are used. For example, X-ray is used and is very helpful in certain places, but it is not helpful where some people consider it should be. Like if you are treating with the dealing with the head injury, X-ray has a very little role, and CT has a lot of information to give, and we use MRI, and very rarely in our setups, but frequently in Western world, ultrasound is used in making diagnosis like stenosis of the vessel or aneurysm in the anterior skull base. Uh, and ultrasound of the skull is done through very thin bones like the orbital bone or the pterion. From there, you can somehow guess uh, the velocity of blood flowing through the vessels. But we are also using intraoperative ultrasound to see if we are hitting the tumor or not. And indications of X-ray skull. There's a limited role of X-ray skull in head injury. Only you can see skull fractures,